Hello everybody, I'm Dr. Sadaqati, a gynecologist. Welcome to my channel OB-GYN Study, and today I'm going to talk about precocious puberty in girls, the definition, diagnosis, treatment, the dosages of this disorder with 10 Q&A. Question number 1. What is the definition of precocious puberty in girls? Precocious puberty is the onset of secondary sexual characteristics before the age of 8 in girls. It can be central or peripheral. Central means gonadotropin dependent and peripheral means gonadotropin independent. Question number 2. What are the main causes of precocious puberty? Central or GnRH dependent. It means early activation of the hypothalamic, pituitary, gonadal or HPG axis. Number 1, idiopathic. It's the most common, especially in girls. Number 2, CNS lesions, for example, hamartomas, gliomas, and hydrocephalus. And number 3, previous CNS radiation or trauma. What about the peripheral or GnRH independent? It means excess estrogen production. Number 1, ovarian cysts or tumors, for example, granulosa cell tumor. Number 2, adrenal disorders, for example, CAH and adrenal tumors. Number 3, exogenous estrogen exposure. Question number 3. How is precocious puberty diagnosed? 1. Clinical examination. Tanner staging of breast and pubic hair development. Number 2. Bone age X-ray. Number 3. Hormonal tests. Basal LH, FSH, and estradiol. GnRH stimulation test, elevated LH more than 5 international units per liter, confirms CPP or central precocious puberty. 17-OH progesterone to rule out congenital adrenal hyperplasia. The other one, DHERS and testosterone, if adrenal pathology is suspected. Number 4, pelvic ultrasound to assess ovarian and uterine volume. And number 5, brain MRI, mandatory if CPP is diagnosed, especially in children less than 6 years or with neurologic symptoms. Question number 4. What is the first-line treatment for CPP or central precocious puberty? GnRH agonists are the first-line treatment to suppress the premature activation of the HPG axis and prevent early epiphyseal fusion. Question number 5. What are the commonly used GnRH agonists and their dosages? 1. Leuprolide acetate or lupron depot. The dose is 7.5 milligram IM every 4 weeks. Can increase to 11.25 milligram or 15 milligram if needed. Number 2, triptorelin or Trelstar. The dose is 3.75 milligram IM every 4 weeks or 11.25 milligram every 12 weeks. Number 3, hystrelin acetate or Soprelin LA. The dose is 50 milligram subcutaneous implant, lasts for 1 year. Question number 6. What is the goal of GnRH agonist therapy? Suppress puberty and slow bone maturation to preserve final adulthood. Number 2, prevent early menarche and associated psychological distress. And number 3, reverse or slow pubertal changes, for example, breast development and menses. Question number 7. When should treatment be stopped? Around 11 years old or when bone age reaches around 12 years. allowing normal puberty to resume. Or if final adulthood potential is adequate based on bone age and growth rate. Question number 8. How is peripheral precocious puberty treated? It's based on the pathology. If the pathology is ovarian tumor, surgical removal. Adrenal tumors, surgical resection. McConnell-Albright syndrome or MAS, aromatase inhibitors, for example, letrozole or anastrozole, to reduce estrogen production. And if CAH or congenital adrenal hyperplasia is the cause, glucocorticoids, for example, hydrocortisone or prednisone to suppress excess adrenal androgens. Question number 9. What are the side effects of long-term GnRH agonist therapy? Injection site pain, menopausal symptoms, for example, hot flashes, mood changes, transient vaginal bleeding is shortly after treatment initiation, and loss of bone mineral density, reversible after stopping therapy. The last question number 10. What is the prognosis for girls treated for precocious puberty? If diagnosed and treated early, final adulthood is preserved. Psychological and social outcomes are improved. If untreated, short stature and emotional distress can occur due to early puberty. Thank you for your attention. If you like this video, please thumbs up and subscribe this channel, OB-GYN Study. Bye for now.